Hello, I'm Hyung Choi, and I'm terribly sorry that I cannot be there in person due to my personal uh, emergency event. But today I'd like to share our recent research on GLP-1 and the preingestive satiation that acts on the hypothalamic circuit, both in mice and humans. This is based on the findings of the GLP-1 drugs that science have chosen as the breakthrough of the year last year, and I want to focus on the symptom or phenomenon that even by just looking at the food or tasting the food makes us feel full. Maybe you will be more expert on this, but Prader-Willi syndrome, there has been many reports on trying to use the GLP-1 agonist for them, and some report said that it is a promising strategy that both in the body weight and glucose control. However, another recent study showed that the compared to the control placebo, the liraglutide, Saxenda, did not have, or semaglutide, did not have this difference in the body weight. However, they reported that hyperphagia, the appetite questionnaire, they saw the differences. So they said it may be based on their hypothalamic functions, the liraglutide on the hypothalamus. So there is not much knowledge about the effect of the GLP-1 and the hypothalamus. That's where I focus my research. And for the symptom that the feeling satiated, feeling full after seeing or tasting the food, there is a recent study that's called imagined eating. So this is how the study is performed. If you look at this M&M's chocolate, if you imagine eating, I eat one, I eat two. So if you keep doing this imagined eating for 30 times, compared to the 3 times, you will have lower desire to eat after just imagined eating. So it's imagined eating for 30 M&Ms decreases the desire. So this shows that by cognition or sensing, the food can decrease your appetite. And I think hunger is regulated by food prediction because if you were to order food based on your current deficiency, so if you see your refrigerator empty, so if you order them, you should stop ordering them because if you see that food's gonna arrive soon, you should not order more. So because if you order by your current refrigerator status, you're gonna overshoot your ordering and order too much. So it would be it will be more adaptive and better for the survivor to decrease the appetite only by prediction of the coming of the food, so normal orders. But only after you see the food is coming, then you can, after the food arrives, you enjoy the food. So I think hunger is regulated by the prediction of the food that's predicted by the seeing the food or tasting the food. So there has been a known phenomena of cephalic insulin, that insulin is produced by just seeing, smell, or sight of the food. And I think this satiation, a kind of break, I think it's easier to understand by saying that when do you start to press your brake? You start to press your brake long before your stop sign. Because if you don't do this preemptive cognitive brake, then you will end up overshooting and passing your stop sign. So it's logical and it's beneficial and adaptive to start to brake as soon as you see the stop sign. Start to brake right now, so you will lose your you will speed a little and you can stop at your designated, your targeted moment. And it has been reported that dorsomedial hypothalamus has a neuron that inhibits hunger neuron, age of neuron. So just by seeing at the food, this neuron is activated, and this neuron can cause the decrease of the hunger. So activation of this dorsal-medial hypothalamus, the leptin receptor neurons, are rapidly activated by sensory detection of the food. So this was reported 80 years ago. So this could be the sensory satiation signal. And why do we need this? As I told you, that in addition to this feedback control after eating, we need this feed-forward error prevention control by sensory cues of the food or the dorsal-medial hypothalamus that will inhibit the hunger just by seeing or tasting the food. That's beneficial for your survival. Yeah, that's the logic behind it. And another way of understand this is understand the thirst and the hunger or sodium appetite. So the neuronal activity of the thirst neurons are inactivated by oral sensory even long before or faster than gut infusion. So that shows that our thirst will be quenched by just tasting or seeing the food. So this sensory satiation, that you decrease your appetite just by seeing, tasting the food. It happens a lot. Who cooks a lot? So who cooks fried chicken a lot? And during the cooking of the fried chicken, many of the chefs or the cookers experience this feeling of satiation only by the cooking the chicken. So we have been knowing this phenomena of sensory satiation, and we want to address whether GLP-1 agonists have an effect on them, and where in the brain does it act, or especially in the hypothalamus. So this is how we did the study. So this is the chicken, large amount of chicken, and baseline questionnaire. So we asked them how much satiation feeling do you feel? I feel out of 10, I feel a score of 1 satiation right here. And after seeing the food and not tasting, just seeing or smelling the food, now my satiation score is 2. And after chewing, this is the most important part of the experiment. You chew the chicken but not swallow it, just tasting in your mouth, just tasting the chicken in your mouth. And we ask them, how much satiation do you feel? 2, 3, 4, 7, 9. And you ingest the food, and we ask again. Surprisingly and interestingly, the control during the oral tasting of the food, the satiation score did not go up. However, during the GLP-1 injection, after the GLP-1 injection, as the subjects, the people who chose like 63 score at the baseline, during their seeing and smelling and tasting, their satiation score rise up steadily only when they have the GLP-1 injection. This is a crossover design, so same person doing the 2 experiments. And at the oral period, when they experience food in their mouth, after they had the GLP-1 drugs, they've said, oh, I feel satiated already, even before the ingesting the food. And we look for where are the GLP-1 receptors are, and we found that human hypothalamus, the dorsal medial hypothalamus, has the receptors for the GLP-1, and mouse also has them. And we did the experiment called optogenetics, where we used the laser and the virus to inhibit the activity of this GLP-1 receptor in the dorsal medial hypothalamus. So compared to the control, where the mouse eat for a moment and leaves the eating, so it's just out of like 10 seconds. However, this mouse keep on eating, never get like satiated. So as you can see, during this yellow shade, that's when the lasers are shine and the neurons are inhibited. Their eating bouts were increased. They eat, their duration of the eating bout, one bout of eating was much increased. That means it doesn't get satiated that much. And oppositely, we did optogenetically activation. So we gave another kind of laser that activates these neurons. And as soon as we activate these neurons, the mouse just stop eating it as soon as we activate the neurons. So we can say that activating these neurons increases satiation. So this is the result in illustration. The black bar is eating bouts. They keep on eating, and the blue bar is the when laser is shine, and as soon as you shine the laser, it stops eating immediately. So I think it's like feeling too much satiated and stop eating. And this is now recording the neural activity of this dorsal medial hypothalamus GLP receptor neurons. And so this is the maze. They have to walk, and eat the food. So this is the first day. So they don't know where the food is. So these neurons are activated only after they start the consumption, the ingestion. However, as they learn this maze for many times, after they learn that there is a food at the end of this corridor, then as soon as they start to move toward the food, oh, let's go eat. So as soon as they know they have the cognition that they will be eating, this neuron activity starts to go up much faster, much before then even start to consumption. So that shows that the cognition response is there. And we did another experiment to show that there's like two different corridors, that one has a chocolate snacks and the other has nothing. So this is the preconditioning when they know that nothing is there, and after learning they know that food is on the right side, and after that we make them the food is not there anymore. So interestingly, only the post conditioning, when they know the food is at the right side, this neuronal activity goes up at this goal side decision moment. And when they know that food is not there, then this neural activity is gone. And this is like a vending machine. They press the poke and the food comes out. So before learning, nothing happens. But after they learn that poking this vending machine provides food, this neural activity goes up. That's another way of showing that this is cognitive. And we used this new technology to record the single neurons, hypothalamic neurons, dorsal medial, GLP receptor neurons. And during their walking toward the food, these green neurons are activated during the walking toward the food. And as soon as they meet the food, these green neurons are inactivated and the purple neurons are activated. So there's two different single neurons, two different types of the neurons. So that's showing in these graphs that the green neurons are active only during seeking, and the consumption neurons are active during the consumption. And so we want to check whether the drug effect has the effect as similar to the human GLP-1 drug study. We injected the drug to the mouse. And compared to the cell line, the control, nothing to the drug, during the cell line, the control, the neuron activity goes up very small at the eating phases, but after injecting drug, the neuron activity is rapidly increasing. So comparing the drug versus nothing, there is a huge increase. I think this neural recording of high increase after GLP-1 mirrors, it's similar to human emotional recording of the rising of the satiation feeling of the humans. So we think this rise of the satiation feeling symptom is because of these neurons. And further, with this brain clearing 3D imaging of the neuron to see where they go from dorsal medial hypothalamus to other hypothalamic areas. So, and the results show that, and in collaboration with the other US lab, Kevin Williams lab, we show that these neurons are acting on the HRP hunger neurons, as shown in this red neuron covering the green neuron. So, based on these findings, thank you for the attention. I think we should learn more about the GLP-1 agonists to help the obese people or the Prader-Willi patients. Thank you for your attention.
Okay, so that was a fabulous talk. Hopefully now we have Professor Choi online to join us for questions. So I think we'll need to wait for the microphone so that he can hear us. Are there questions in the room?
Yes, I can hear you. Can you hear me? No? Oh, can you hear me? I am
Yes,
talking.
we can hear you. Yeah, we can hear you. Excellent. I'm going to ask the first one while other people think. So from the patient data, I'm wondering if you can give us an impression. What proportion of patients do you think respond in this way when with GLP? The data you showed at the beginning, because obviously patient data is very much more variable, and so I don't know if that question makes sense.
You mean about the general obesity or focusing
Yes.
on the general obesity? So for the general obesity, we still think that like 10% or more than 15% patients do not have the enough weight loss as the others. So there is the problem of the non-responder even for the general obesity. But when it comes to patients who have a specific cause of the obesity, like a Prader-Willi or other patients that we have like neurosurgical consequence made complication obesity patients, the response rate is much lower. So I think this GLP-1 is acting for some of the patients, but we don't know the predictor which will guide us to who will benefit better for this. So there are more research should be done so that we can find the people who will benefit. Yes.
Great, thank you. Are there other questions in the room? And Kath has the microphone so that you'll be able to hear it.